Okay, good afternoon. Thank you for the introduction, and on behalf of my colleague that couldn't be here, I'm here to present the paper that you already introduced. So, the improvement of the results in healthcare through the transmission of information to the patient within a relation of empathy and trust is already a verified hypothesis. Healthcare professionals should base themselves on interpersonal competences through their daily work routine to promote quality in medical imaging, patient safety, and technical excellence. We did the study for the exploration of patient perception regarding the performance of the radiographer in terms of interpersonal communication skills. Also, we seek to strengthen the idea that the patient is the central figure in the entire healthcare system and that the whole professional practice of the radiographer should be adapted to the holistic and multidimensional human being that is the patient. We did this study also to verify that the professional practice is carried out in accordance with the phrase that I stated, and that the radiographer's code of ethics and the chapter of patients' rights and duties are accomplished. So, we performed quantitative, descriptive, and correlational study. We used the communication assessment tool Makoul and all the 2007 adapted for the professional reality of the radiographers in Portugal. The questionnaire was composed by 13 questions with a 5-point Likert scale. Paper-based instrument delivered and filled by the patient after the performance of general radiology procedures in 2 public hospitals. We got 225 valid questionnaires from the convincing sampling. Patients aged between 24 and 85 years and provenient from the ambulatory emergency room and from internal patients from our hospital. So, as we can see as our result from first part of the questionnaire of the socio-demographic evaluation, we have 162 female responses and 93 male, aged between the 24 and 85, with different scholarship from the first level to the PhD, with different type of patients, from outpatient, inpatient, and ambulatory, and for different reasons like routine, emergency purposes, and from the known disease, from 2 hospitals. As a result, first of all, we did the consistency evaluation, and we had that our questionnaire have a height reliability scale and Cronbach alpha of 0.98. So we observed that in our case, the highest ratings was given to the respect for the patients, greet the patients, and for time available to the patient-centered care. The lowest ratings was given to involve patient in decision-making process, encouraged to make questions, talk with the patient about the next following steps. As we can see here. We also did the correlation test, and we had the positive and statistically significant at 0.01 level for all items. And no statistically significant difference about the patient perception of the radiographer interpersonal skills were found between 2 different hospitals that were inquired. So, as a discussion, in the previous studies have several factors in common with our study, since the item respect for the patient was always the top ranking, while encouraged to make decision has one of the lowest score in all studies that we have compared with our. Older patients prefer a radiographer who takes more parentalistic attitude, while the younger patients prefer to take the control of the health decision-making process. In conclusion, radiographers' communication skills were evaluated with good levels of patient confidence, with the radiological examinations. Despite the overall positive results, this area of healthcare service delivery must be accorded to the attention it describes to continually improve on patient satisfaction through improved communication. Communication with the patients take an important part in improving quality healthcare. As such, interpersonal and communication skills are considered a core area of radiographer competences. An efficient interaction with the goal of providing a humanized care in radiology has many benefits, such as effective patient clarification, increasing psychological well-being, increasing predisposition to return from the next examination, and satisfaction. Thank you for all your attention.